Greetings, Staffordians. This is Stafford Mayor Cecil Willis. First, I want to wish each and every one of you a belated Happy New Year. As we enter this new year, I thought it important that we invite Dr. Joe Anzaldua here to have a conversation with you regarding COVID-19. It's been a little time since he was here to update everyone. Dr. Joe is not only a longtime friend of mine, but he is a tremendous asset to the city of Stafford in helping and guiding us through a myriad of medical questions. So I'm going to invite Dr. Joe here now and turn this over to him to update you on where we are in Stafford and what his perception is of where we're going forward with COVID.
Thank you, Mayor Willis, and greetings to the citizens of the city of Stafford. COVID-19 remains a threat to our community, as evidenced by the alarming increase in positivity rates we are now seeing, especially in certain areas of Fort Bend County, including Stafford. The county continues to remain at coronavirus threat level of red, which is the highest level of community risk. We expect to see the surge during winter flu season, mostly because of the recent holidays where more people were traveling and visiting relatives and friends, and because people are spending more time indoors due to the colder weather. There's also a B.1.1.7 variant strain that apparently started in the UK, but has now found its way here in the US, including Texas, that has the potential to increase the US pandemic trajectory in the upcoming months. So we must all continue to take all necessary precautions to stay safe. Now is not the time to be letting our guard down. The City of Stafford continues to work with regional health care authorities to ensure we remain informed of all issues that impact the safety of our community. This includes the distribution of new vaccine that will keep our community safe and help return us to a more normal way of life sometime next year. It's important that as many people as possible take advantage of the COVID-19 vaccines when they become available. As you know, the first FDA-approved vaccines are now being provided to first responders, healthcare workers, and long-term care facilities such as nursing homes. In addition, people 65 years and older and those with certain medical conditions that can predispose them to COVID-19 are now eligible. To ensure the effectiveness of these valuable resources and create the herd immunity that we hope will protect our families, we must get vaccinated unless you have severe allergies to injectable medications or your doctor tells you otherwise. I know many are asking if the vaccinations are safe. I still believe the answer is a resounding yes. Here are a few things to know about the current COVID-19 vaccine that have recently been approved by the FDA. Vaccination is considered to be a very important tool to stop the pandemic. Although we only have 2 vaccines that have been approved under the Emergency Use Authorization, EUA, by the FDA, there are many being developed and are awaiting approval. The vaccinations are free to all Americans, and there are no associated costs. Currently, there is a limited supply of COVID-19 vaccine in the U.S., but production and distribution should start to wrap up in the next few weeks and months. Currently, the 2 approved vaccinations are Moderna and Pfizer. Both are a 2-shot series, and the reported effectiveness is 94%, but this is not achieved until both doses have been administered. So the second dose of the vaccine must be given within the specified time frame after the first dose. So please consult with your healthcare provider for more specific guidance on the vaccine that you're going to be getting and, of course, your health. Vaccination is still recommended even if you have already had COVID-19 and recovered from it. Since the current vaccines do not use live virus, you cannot get COVID-19 from vaccinations. After COVID-19 vaccination, you may experience some mild side effects such as a sore arm or a headache, fever, or even body aches. For most people, these side effects should not impact their daily activities such as going to work or going to school. Symptoms should resolve in just a few days. So the vaccines are safe. So until we have sufficient number of Americans vaccinated, herd immunity, everyone should continue to take the following steps to prevent the spread of COVID-19. Wear a mask fitted appropriately to your face That means covering both your mouth and your nose. Stay at least 6 feet away or apart from others, especially non-family members not living in your household. Avoid crowds and large gatherings, especially in poorly ventilated indoor spaces. Wash your hands with soap and water or use a hand sanitizer with at least 60% alcohol. Stay home if you're sick and call your healthcare provider for any further instructions. And get a flu shot as soon as possible if you can. Clean and disinfect frequently touched surface areas, especially at your workplace. So remember the 3 W's. Wear a mask, wash your hands, and watch your distance. For more information and updates on the COVID-19 coronavirus and vaccination availability, please visit the Texas Department of State Health Services, www.dshs.texas.gov. Thank you.